Hi, I'm Dr. Nilam Khurana, and congratulations on your new baby. There's a few things that I always like to tell parents in the first couple of weeks after the baby's born that you can be aware of to just watch out for and know whether to be worried or not. So I wanted to put it down in this video so that you guys can have access to it, and with all the craziness going on with having a new baby, just be able to refer back to it. So we have booklets that we hand out that have information. There's tons of resources everywhere, but I give parents a little bit of a spiel whenever they're in for their newborn visit so they can have an idea of what important things to look out for and worry about and what not to worry about. So there's a lot of things that you're going to worry about as a new parent, and getting a little bit of a heads up on some of the things that aren't that scary but look scary is important. So and I'm just going to go over some of the common topics that parents really are wanting to know about. So one is bathing. We say every 2 to 3 days of sponge baths. When the umbilical cord falls off and you can open it up and it looks like a belly button, then you can do the regular baths. When it's falling off, the body does what we call a rejection reaction, where it actually gets a little bit of oozing discharge and a little bit of blood. Not so much that it's going to be really a copious amount, but usually we'll leave a dime-sized stain on their onesie. So nothing to worry about with that as long as it doesn't have an odor to it. If it has an odor, or obviously if it's taking too long to fall off, which you'll be coming in early and regularly to make sure that it does fall off and it's all closed up and all of that. But if it does take too long, then there's other things that we need to do just to kind of get it moving so it's not sitting there and then leading to other complications. So, and then for girls, they can have full-on bright red vaginal bleeding at about a week or two of age. They'll have discharge throughout, and it has all these crazy things to do with the hormones from mom. And we want to make sure that you know that it's normal and it's nothing to worry about. And it's blood. So it's not these pink crystals that we see in their urine sometimes. They're like a pinkish dot. I call it Sedona brick red on their diaper where the pee is going to be coming out. That's usually a sign of some dehydration. So not always, but typically is. And so that's totally different than the bleeding. If they do have that pink Sedona brick red stuff on their diaper, then that's something that you should talk to your doctor about or talk to the provider that's taking care of you. So, and then with boys, same thing with that pink brick dust. Usually if they get circumcised, there's not really anything bleeding afterwards. So some parents will confuse it with actual bleeding and they just think it's a circumcision, but it's actually the dehydration and not necessarily that. It's blood from the circumcision. And then parents will be asking all the time, like, what their sleep cycle is, if this is normal. So what I like to tell parents is the first 2 weeks of life, you're going to be just exhausted and trying to figure out what cry means what. Once you figure out this means hungry, this means I'm tired, this means I just want to be held or consoled, then you'll be able to get an idea. And that usually takes about a week or two. Until then, you're just running around like crazy, trying to make sure that the baby is content, sleeping, fed, changed, and you're tag teaming so that you guys can get some sleep in there. So, and God bless you. I don't even know how you guys are doing it without additional family members with COVID, but hopefully now that things are opening up, you're able to get some additional help, because it's not easy to do it with just 2 parents. So, and then that leads into the fact that the lack of sleep and the craziness of life can lead to postpartum depression. And so for women, the estrogen you have is really, really high, and then it just drops as soon as you have the baby. And so that estrogen drop makes postpartum depression a very high risk. And we always want you to be aware of that possibility and keep an eye out for each other and make sure that those baby blues are fading by about 3 weeks. And if it's not, then making sure you're getting into your GYN and talking to them about it. But the other sort of not really talked about part is that men also have postpartum depression. They go through all these changes, and life is totally different, just like it is for the women. They don't have the hormonal components to it, but they do end up getting sad and just overwhelmed and devastated. And the lack of sleep for both of you guys is going to contribute to postpartum depression as well. So the things to help you with postpartum depression is getting enough sleep, getting enough exercise, and getting fresh air. And so those are things that you're all missing during that first couple of weeks of life. And so making sure you can pull yourself out of it, organize yourself so that you're taking care of each other, and making sure you're seeing those signs and getting to the point where you can do some of these things so you can actually help yourself. So obviously exercise isn't necessarily the priority when you're just trying to sleep. But then if you can get out, get some fresh air, go on a walk with the baby. Even with COVID, it's okay to be outside away from people. Obviously the temperature has to be okay. And when the baby's covered. So you have those stroller covers with the things to protect them from the sun exposure, like the SPF in the material itself. There's lots of different things that you can do so you can get out, get fresh air, still let the baby get out so they're not stuck in the house the whole time, and be able to help yourself emotionally. Some other things about the baby that you should be looking for. So we say for pees, they should be peeing about 1 time per day of life, which means the first day we want at least 1 pee, the second day we want at least 2, the third day we want at least 3, etc., etc. We do want them to start changing their poops by the time they're 4 or 5 days old, so that icky, sticky black stuff will get wiped off much more easily as it's transitioning. And then once you get to the full-on regular baby poop, it's that liquidy, yellow, seedy poop with it looks almost like curdles in it. And that stuff is much easier to wipe. And that yellow poop is actually the stuff that gets rid of the jaundice. And so a good number of kids will have jaundice. And the most important things to help with the jaundice is making sure they're hydrated, making sure they're getting enough food and their poops are changing. And also that indirect sunlight will help. So until your body can poop it out, if you get that indirect sunlight, it helps to break it down so that you can pee it out. So they going on walks and stuff like that is fine with them covered, but then the indirect sunlight we usually say to do at the window, like inside, so that they're getting the other rays that are coming through. It's the blue rays that they need, without getting all the UVA and UVB and all of that. So, and then you're gonna learn your baby's feeding cycle. If they're breastfeeding, it does seem to go through a pattern where they do some cluster feeds in the morning and then cluster feeds in the night, and then feed a little bit more often during the day and then less often at night if they're nice to you. And that nighttime feed will continue to expand. So there's gonna be a pattern you're gonna figure out with your babies. Some babies are asleep all day and awake all night because they fell asleep being rocked by their mom's movement during the day, and so they have baby jet lag, and it takes like a week or 2 to get over it. And so if they don't seem to get over it okay, then usually I say to wake them up more often during the day. Don't let them sleep that long stretch during the day, which means you're more exhausted because you're trying to make sure that they're awake more during the day, and then of course they're wanting to be awake more at night. So other things, the skin peeling, it's normal for them to have the peeling skin for probably a couple of weeks. It can be up to 6 weeks. And it's just this layer of skin that needs to be washed off, but they don't really wash off very well with the sponge baths. And so after a couple of good baths, when the umbilical cord is all closed, then you can do those, washing it all off, and then you can start using lotion. So that's the reason not to use lotion. It's not like it's harmful, it just doesn't do anything. It just sticks it back on. So if you just stick it back on for a picture or something like that, fine. And then after they've gotten rid of that layer is when the lotion actually moisturizes their skin. So I usually say to go with a moisturizing soap or cream like Aveeno, because it will help prevent the dryness and the rashes and stuff to a certain extent. I also recommend that you use them on the face. A lot of parents won't use it on the face, but things like Aveeno and Cetaphil, and there's a bunch of different ones out there, they're good for their skin and they help to hydrate. So, or keep that hydration in. So you want to actually use those soaps as well as the creams on their face. And then a lot of babies will get the cradle cap, which is the buildup. And with those, you want to massage it out with the oil, comb it all out. It'll look worse when you comb it because you're picking up all these flakes that are sort of stuck onto their scalp, and now it's in their hair. But then you wash it out, and then it does well. Sometimes if it's not doing well with just that, then you have to use a little bit of Head and Shoulders shampoo, tiny little bit on a wet washcloth when they're laying, usually on the diaper changing station, and then you can rub it in their scalp, and then you want to take a wet washcloth and make sure everything is out before you're actually doing the baths, because you don't want any of that getting in their eyes. It'll sting like crazy. So those are the big things, like for the first couple of weeks of life. There's a lot, and it's a bit of an emotional roller coaster, and life definitely is changing drastically. So, but it's beautiful, and I'm hoping that after that first couple of weeks, you find the enjoyment. Maybe even the first week or two, you'll find the enjoyment. If they breastfeed well and they're great feeding, they're great at latching, you get that whole hormone release. So that's kind of nice, the love hormone, oxytocin. And there'll be a few moments of peace that you'll be able to enjoy past all the chaos of that first couple of weeks. So congratulations, and thanks for listening. And then, there's all the other videos that I have posted for the early child development, so please keep an eye on those to make sure that you're getting all of the access to the information that I want you to have for that development that they need, because we need to teach our little babies everything, and they use all of that information that they're getting from us to develop their brain. 90% of the brain development is in the first 5 years of life, and I say that all the time, but it's true. Thanks for listening. Congratulations.